We have discussed the basics of qualitative research. We have seen the research paradigm, and we have seen that various types of research method, and we have seen how will you develop a research protocol. So a research protocol will have a introduction, then review of literature, and then research methodology. And in research methodology also, in that tool, whenever you submit your proposal, you have to give the interview guide also. How to develop that interview guide, this session we'll focus on that. So now we have to understand the concept of open-ended and the close-ended question. Because yesterday also I made this statement that the data collection tool in case of a qualitative is researcher itself. Because researcher, the way he asks questions, he probes, he interrogates, that's the most important thing in the data collection for a qualitative research. Now, you ask this question to a patient who is taking a treatment from AIIMS Delhi for any disease XYZ. So I ask this question, rate your level of satisfaction at AIIMS Delhi on a scale of 1 to 10, where 1 means worst and 10 means excellent. So from a qualitative research perspective, what is the problem in this question? Please type in the chat box. Satisfaction. Okay. But you must have seen many tools also who are there for, they are validated for measuring the patient satisfaction and client satisfaction from hospital. So level of satisfaction. So if I ask this question from you, okay, so Sushri is also writing, choose a number from 1 to 10 only, but he cannot speak out his perspective. Yes, true. So you all are right. So just imagine the dilemma of this patient whenever he is rating the product. Okay. You must have seen whenever you go to a mall also for shopping, they also after shopping, they write you to give your rating. So they always give specific thing that what did you like? Did you like the diversity of clothes? Did you like the person who greeted you at the door? Did you like the ambience of the store? So specific points are there. But in this case, if you ask a general question, then there will be dilemma, because the person will think, the patient will think that the experience of doctor was very good, but the receptionist was very bad. Then you may argue, why not take separate response? So now if I ask this question, like rate your level of satisfaction at reception counter at AIIMS Delhi on a scale of 0 to 10, and then with doctor at a scale of 1 to 10. But again, patient may land up in dilemma in rating the doctor, because he might say that, yes, the doctor was good, but he did not give me enough time. The doctor was excellent, but he was again talking to someone else. So recently we had a few discussions with the patients, and then that patient said that the doctor was very good. He was very knowledgeable, but he kept on talking over phone while my wife was lying down for examination, and he kept on talking to some other person, and which was not a very important talk, which he could make out for maybe 25 to 30 minutes. So he was very bugged up with the behavior of the doctor. So then you can say that in this case, there was a specific thing which he has used. So, but if you are asking overall this thing, how he was good, so there always will be a dilemma with such type of subjective questions like satisfaction, like anxiety, anger, those questions. So why this dilemma? Because we are not giving enough opportunity to the patients to express his or her satisfaction in detail. So that's the problem with the close-ended question. So you have closed the communication. The patient, the people who want to express, because you will see there are many people who are very expressive in nature. So you have not given them opportunity to express their full experience. So to reiterate, in quantitative purpose, the participants' response we get through options. But in qualitative, I said yesterday also that words are the data in qualitative. So that's why I say that imagine from a data, analyst of qualitative. If your transcripts are not rich, if it is only one line like yes or no, or very few sentences, then you will not be able to do anything with that transcript. So that's why you should have rich words in the responses. And we'll see when you conduct an interview how we could make it better. So, interview guide in case of a qualitative is just a rough guide. Again, there is a high scope and high chances that this will not be very strict. It's just a rough guide. So, now coming to how to develop the interview guide. Now, please remember that it is your responsibility as a researcher to help the participant remember the event or the thing. So that's why the first thing is you should be very patient while you take the interview. There are many good quality that a qualitative researcher should have, and one of the quality which is must, which is the patient listening. So that is there. So it is your responsibility to help them remember the episode or event, and we'll see for that we have got prompts. So there is something known as the prompts which help the participant to remember the exact episode or event. Now you should consider two main concept while you develop an interview guide. So the first thing is what type of questions you should be asking. And the second thing, what type of questions you should avoid. That is very important because many times you will see that you started the interview on a very good note. But while you are taking the interview, you said something through your verbal or non-verbal gesture, and now the participant is not interested anymore in giving the interview. And the interview, it got closed prematurely. So it can be there. So especially with people like doctors, like students, maybe who are very literate and who have got a high power dynamics in the society. So you should always try to avoid questions which shouldn't be there, and which may lead to the premature closure of your interview. So the interview guide has got three sections. The first section is the opening section. The second section is the middle section. And the third section is the closing section. Coming to the opening section should have a introduction of the topic or the context. You also take give them the participant information sheet, that why you are doing this research. You explain them the benefits and the risk involved in the research, and then you take the written consent also. So these days, generally, you should take written consent of the participant, and that consent should include the part that you are going to audio record the whole conversation. Again, you say that there will not be any identifier, like you don't ask their name or maybe age. That is there in the consent form. But while you are audio recording their interview, you don't take any personal identifier. So that is there in the introduction, in the opening section of your interview guide, where you explain about the part, the topic, you give them participant information sheet, and you explain about the research, and then you take the written consent. Then comes the middle section. So the middle section it has the interview questions, the topics, prompts, and probes. And then closing section has got additional points like any query, and then thanks, always thanking the participant. So this coming to this one by one, So is there any fixed guideline to make an interview question? What is your answer? Is there any fixed guideline to make an interview question? Like you have got in quantitative. So there are some tools which are already available. So Akanksha, Sandeep, Manisha, Sushri, they are writing no. So true, there's no fixed guideline how you should make an interview guide. There are some broad guidelines and there are some tips which you should remember whenever you make an interview guide. So remember your central questions and sub questions. So if you have framed your sub questions well, and if you have done your literature mapping, then it will help you in making the interview guide, definitely. So now first tip, first you do the literature review, and that's needed because literature review helps you to make a literature map also. It helps you to make sub questions also. So that's important that a thorough literature review should be done before you start making the interview guide. Then you should always ask some initial questions. Like generally we start like tell me something about yourself, or if the patient is visiting you, then you always ask like tell me about your journey, how have you felt while traveling to AIIMS Patna. So all those things, some initial questions are needed. So why those initial light questions are needed, if even if you don't ask those questions, because those questions are not going to be coded, you are not going to get any theory out of it. Then also, why it is a very important part of the interview guide. Anyone, you can type in the chat box. Rapport, ice breaking. Ria, yes, very good. That helps that the person starts speaking. Otherwise, it is very difficult to make people talk. Like remember yesterday event when I asked initially like can someone read it for me? So out of 60 participants, no one initially, because I know that it is on the Zoom and you people are not very comfortable now in talking. So initially no one talked, and then when I asked Akanksha to talk, then she started talking, and then few of you have started talking, and today also like we have seen that few of you are talking. So initially like when we conduct a workshop, we always take the introduction. That's whenever you attend a workshop, whether it is a physical workshop or whether it is a offline online workshop. So we always take introduction. So that introduction also helps in ice breaking, making a rapport. Then because you have to be there for 5 days, and then you people can talk to each other, especially in qualitative, this talking is very important. So because in qualitative, because of the person's words, you will get a rich transport. So you have to encourage the person to talk. So if you ask these questions, that shows two things. First thing is the concern. Like if you are asking like how have you traveled up till this point, because see AIIMS Patna here in our, it is at a very outskirts, and if people are traveling to this point, the roads conditions are very bad and there's a lot of traffic jam. So those things which initially says that you are concerned for the participant. So that concern, empathy or gesture is needed in these initial questions, and you give the opportunity to the participant to express their general view, because that doesn't need any high literacy status if they have to experience about their family. So you may ask like who all are there in your family, how many kids, like what do you work, you can ask about their work, what do they do, like if he's a labor, then you can ask about the his work structure, how many days he gets the work, all those things. Like it's a very general discussion. So it might take initial 3 to 4 minutes of your talk in just asking some light questions, but that is needed because once you have got that link with the participant, because you see now that we co-construct. So participant and the researcher, we co-construct the knowledge. So that's why uh, both should be very close, tight knot, and there should be very good rapport between the participant and the researcher. So there should be some initial light questions to begin with. Then we should have some broader questions, and then we narrow them down to know the details. So you always start with very broad questions. You don't ask that, like we have seen in the central theme, a central phenomena or the central question. The central question just ask about the very broad concept, that what and how regarding the participant think about that. So you have to know their perception about that particular thing. And then many times you ask hypothetical questions also. Now, what are these hypothetical questions? So, like, this is one question, that after amputation, how your life got changed. So, this is one question. If you have to make a hypothetical question, how will you make? Yes, please type in the chat box. Hypothetical means you ask the person to imagine maybe herself or himself in the opposite situation. So if your leg had been amputated, how do you think your life would have changed? So maybe the hypothetical question would be, what do you think would have been different in your life if you have not been your leg amputated? This is one hypothetical situation. You give the opposite of that. Yes. So Sundar, if your leg had not been amputated, do you think you would have been happier? So again, do you think would have been happier? This is a close-ended question or an open-ended question? Sundar, what is your opinion? Closed, yes. So if you ask close-ended question, then the person will say no or yes. Then it will get stopped. So that's why you should never ask close-ended question, because then what will happen? Your question will be of 4 lines and participant answer will be of 1 line. Your question will be of 5 lines and participant answer will be 1 word. So then you will not be anything to make codes or make theme. So your question should be of 1 line and participant answer should be of 6, 7, 8 lines. That's how you should try to ask questions. An interview guide will help you in making open-ended question. And if you have, if you are conducting, because most of you will conduct the interview in the local language, like maybe MP and Bihar, UP, we are Hindi speaking area. So we will conduct the interview in Hindi. Those of you who are from South or from Karnataka or Tamil Nadu, Andhra, Kerala, you will also do the interview in the local language, because it's difficult. Yes, definitely if you are doing the interview in the English for the medical students, it's okay. But again, you have to translate your interview guide in Hindi, and you have to see that Hindi should also be very, you know, what Hindi will we talk or the language we talk. You don't have to do Google translation, because meantime what students they do, they just put all the English one in the Google, they get that translation and they put that in the interview guide and then they submit that in the IRB. But if you go through that questionnaire, even you will not understand what is the meaning of those words, because we don't use such words. So maybe you can use English also. These days we call English, mix of Hindi and English, especially in Hindi speaking, I'm telling, maybe not for the South or the people who have got that language, maybe in Rajasthan or in Punjab. Everybody has got their own native language. So you should try to use those language while interviewing, where the participant will be comfortable in answering, because these things will not be answered in a very watertight language. Like when we conducted the stigma discrimination thing in HIV, because in Bihar, many people, most of the people who are the patients, they speak either in Maghi, Mathili, Bhojpuri. These were the languages. So we conducted interview maybe people were speaking in those language only. Like we were trying to speak in their language, and then they were answering in that language. And then ultimately we got first converted that into Hindi and then to English, because for transcript, you have to make your, that language should be in English, that transcript should be. So that's why the researcher or the interviewer should have the grasp of the local language also, because that will help the terms which they use. And again, you have to ask clarifications also from those people. So now this is one thing, one question, again, that hypothetical question which I was talking, that what do you think would have been different in your life if you have not, if you haven't been your leg amputated? Again, this is one question. Like if I ask this question, you are a studying student, that it is a belief about the group activity, and one of your question from the student was as below, that what do you suggest, what is your suggestion to improve group activity? If you ask this question from a student, now if you have to reframe this as a hypothetical question, then how will you ask that? Imagine that you are a teacher, then how you plan a group activity? So you can give the role of a teacher to the student. So you just ask the student to be in that position, especially in our context. Like we conducted one study in the immunization, then we asked the asha, maybe the medical officer, you can ask from them that if you are the district immunization officer, what remedial measure would you like to do? So you can hypothesize, or you can make them imagine that post or that situation, and then you can ask those particular thing. Then the tip 5 is always think about the data analysis while framing questions, because ultimately your transcript are the data for you. So like I said that in the transcript, if you make a transcript, those of you who have made it, you know that there is a I for interviewer and R for responder. So the paragraph of R should be very long and I should be of 1 or 2 lines, not more than that. So now I'll just tell you how to develop an interview guide. So there are some steps for developing interview guide. So just we have to open a Word document, and then you have to write the research questions, and then we have to focus on research questions. So here it will be like the same central question and then sub questions, and then we should try to write as many questions which is possible, which seems to be relevant to the topic. And then again, first I make a very rough guideline, very rough interview guide. Then again, I refine and rearrange. And once it is done, then again, you may rearrange the question. But arrangement might differ when you are asking the questions. So, this is like, yes, so that was for the inductive one. So remember, we did inductive and deductive, two sort of concept while doing a qualitative research. So inductive is when you don't have much idea and you start new, and then while making the process, you develop that interview guide. Now there is something known as the deductive. So deductive is you have already got a framework. So this step which I have written, this is for the type of inductive interview guide. But if you have got a framework, if you have got an existing framework, then you can use that existing framework to make your interview guide. Like there was one study which we conducted here, that is the understanding perspective on need and acceptability and uptake of potential RSV, which is the respiratory syncytial virus, interventions for under 5 children in India. And those interventions were the vaccine and the monoclonal antibodies. So there we have used, this was the research, this purpose statement to assess the perspective influencing the acceptability and uptake of potential RSV interventions using among the end users, healthcare provider, and program level stakeholders. The study will be guided by the themes adapted from the framework developed by the WHO Global Expert Group, where they have given this framework that measuring behavior and the social drivers of vaccination. So they have already given this framework before they have started the work, that they have divided this thing like, perceptions of disease of RSV and acute lower respiratory tract infection, like disease awareness, risk perception, and impact. Then this second was like influencing for acceptability and uptake, like interventions for RSV and RSV like diseases, where they were desiring to measure the contextual factors and the preference for channels or formats of receiving the information. And then regarding their health related decision, which again then they inquired regarding the product attribute and preference, regarding like how much, what frequency and effectiveness, dose, side effects, etc. And then delivery approach also, whether they want it at home or maybe outreach session or antenatal clinic at that site. So this was the overall this deductive framework which they have already given, and then they formed the questions based on these framework. So it was not inductive in nature. So in health, many times health system research, you if you have got an existing framework, you can again check that framework. Again, it is not necessary that your answer will fit into these framework, but you have started with a deductive, and then you may come up with your own map. Like the results are yet to be declared. I mean, we still are in the process of analyzing the data, but the result which we have started with the deductive framework, but it may happen that we may add something to this deductive framework, that which was discussing, whether you are generating a new theory or you may fill something into the theory existing one. So that's why that is a possibility, that you start with a deductive and then you propose some changes again in the deductive. So you have come up with your own this thing also, themes and your own categories also. So that's again one way of developing the interview guide. So just to revise, interview guide can be of two types. You may, if your nature of your inquiry is inductive, you may start with your research question, and then you may form the sub questions, and then you can inquire. If your nature of inquiry is the deductive, you already are using some framework, then you can use that framework to frame some specific questions, and then you can make an inquiry. Maybe at the end of the inquiry, it may be something else, not the existing one. This is again what same model. Now again, I will just show one interview guide, how we have made that interview guide. So that research aim was to assess the perception and perception of care and treatment among HIV positive patients at antiretroviral treatment centers. So there we identified three aim. So for that research aim, we identified three questions. So the first question was like, what are the perceptions of care and treatment among HIV positive patients at ART center across 6 districts of Bihar? Then second was, what are the barriers to accessing care in those which was perceived by those HIV positive patients? And then what are the perceptions of HIV positive patients among healthcare personnel at ART center and community members? So now in that, I'll show you that interview guide. So I'll come to day 2, and then in demo files, let me see, where is that file? So this one. So yes, you can see that initially this was the research question, that what are the perception of care treatment among HIV positive patients. And then because we discussed that a research interview guide has got three sections, an opening section, a middle section, and then the closing section. So you can see here that I've started with this question like, tell me about yourself, and maybe prompt. Now there are two terms, prompt and probe. So what is the difference between prompt and probe? So prompt is to help them in memorizing something. Like if you ask them, tell me about yourself. And if they don't understand, then I may say, okay, आप अपने job के बारे में बताइए, आप कहाँ रहते हैं, and you tell me about your family. So you can ask a little, you can give them prompt so that they are clear. What do you mean by tell me about something? Tell me about yourself. So this is prompt. Now there is something known as the probe. So probe is like you, if you want to dig down or go deeper into some perspective, you probe further. So that is the probing. So there is a difference between prompt and probing. Now now the next question is how he came to know about her status, then what kind of services that person expects out of ART. That is again a sort of hypothetical question, like what kind of question that the person is expecting. Then you are asking like, how do you feel about the staff at the ART center? Then how is the follow-up care done? So you can see the type of questions. There is no question where the answer will end in yes and no. Like all the questions are like what and how. So that we said initially that your main this thing should constitute the what and how. Why you should be keeping yourself, if somebody is so vocal and if you think that he may answer why, then you can ask that. Otherwise, what and how, that should be the mainstay of the inquiry. Again, for the second question, you can see that what are the barrier to accessing care, if any, as perceived by HIV positive patients. So you can ask like, what are the difficulties which they face or which they feel? Again, this is one hypothetical question. Can you see? Like if you are the in charge of the ART center, what would you have done to improve the situation? Can you see? This is an example of hypothetical situation. If they are not understanding, like what will you do? You can make them be at some post or feel at some post and then tell like what would they have done. So that is again a hypothetical question. Then again the third research question was like, what are the perceptions of HIV positive patients among healthcare personnel at ART center and community member? Again, there are some open-ended questions like, tell me about your, and this will keep on writing, let me see, work here and there if not possible. No, I think this is something else. This is the response. So I will delete this. This is not the question. So then how would you interact with the patient in this facility? What kind of services are available in this ART center? And then there were many questions, but I've just given you few, uh, questions. The interview guide was very long, but I'm not giving you because that will take a lot of time. So this is some rough guideline how you can develop the interview guide. So now there is a breakout room activity. And how many breakout room are we? Okay, so I will just read out the activity for you people and what you are supposed to do. Just so this activity is here. So you have to read the given background and objectives, and we need to work for objective number 2. So this was the project, like doctor shopping or healthcare provider switch. That is the switching of doctors by patients and families, extent and its effect on the health outcomes and quality of care in Madhya Pradesh. So this was the title. The background was doctor shopping or provider switch. Or I can ask someone to read this for me. So who will volunteer this to read background? Any?
Ma'am, I'll do it.
Okay, thank you, Garima.
जी. And the background is doctor shopping or provider switch, in which people change their healthcare provider without professional referral, has been reported in many countries as an important cause of avoidable healthcare cost and poor health outcomes. Determination of its extent and predictors has not been reported in India yet. So the objective one is to quantify the extent of provider switch among community dwelling population of Bhopal and Raisen district of Madhya Pradesh.
So this was the quantitative objective because it's a mixed method study. So we don't have to focus on this. Now coming to objective second. Yes, Garima.
To explore and quantify the reason of the provider switch behavior from the perspective of user, providers, and health system managers.
And this was a third objective. So we don't have to focus on the objective 1 and 3 and fourth. So again, you can see here that they have just briefly summarized this methodology. And then you can see it was a community-based longitudinal design in the urban community and community dwelling. These were the participant and sample size they have again mentioned and the sampling technique. So now that this objective to explore and quantify the reasons of the provider switch behavior from the perspective of users, providers, and health system managers. So it was a multi-page iterative mixed method study design. They have used the phenomenology and ethnographic approaches. And again, the setting is the private and public health system. Population is the patients and relatives. Patients, relatives, physicians, health system managers, and academicians also. And 20 to 30, they have planned for 20 to 30 IDIs each for this FGD, then key informant, and then participant observation. So now this was the framework. So Garima, have you used this already given framework or you have developed this framework?
No, ma'am, we have developed it by studying various other frameworks like health seeking behavior by Anderson. Then there is one California, Calgary for doctor patient encounter phase. Like that, we have developed it from various other frameworks and some literature search and researches. We have developed this thing.
Okay, so do they need to stick to this framework or are we are expecting them to be inductive in nature right now in this breakout room activity? Because uh, we will divide the participant in 4 participants in each breakout room. And then what you can do, this topic, this is shared with you people, this as a PDF format. It is there in the chat box also. You can download from there and then you may develop the interview guide in your breakout room. So there will be 4 participants in each breakout room, and among 4, please decide there will be one group leader and there will be one record keeper and the timekeeper. So the proposed time for this activity is 20 minutes. And first you try to have a ice breaking talk with each of you, and then you need to develop interview guide or a participant observation checklist. So the room-wise activity, room number 1, 2, 3, and 4, you will develop an IDI guide for patients to know their perspective on the doctor shopping and its effect on health. Room number 5, 6, and 7, you will develop an IDI for doctors to know their perspective, because there are, you know, 2 stakeholders here in this breakout room activity. One, you have to develop for the patients and relatives, and second, room number 5, 6, and 7 for their interview guide for doctors. And then room number 8, 9, and 10, you will develop a participant observation checklist to observe doctor-patient interaction in a OPD setting. So these are the 3 tasks. So once you have a rough draft of your IDI or checklist, please share it in the WhatsApp group which has been created and mention your room number also. So this is the task of the group leader. So group leader, please mention your room number and the name of the team member while posting in the WhatsApp group. Okay. And now how to identify who will be the group leader? So the senior most person in the group be the group leader. And then the group leader can decide for the this record keeper and the timekeeper. Okay. Okay, there are some. Okay, we'll see it later. So Akanksha, can you please open the breakout room?
Yes, ma'am. There are total 8 rooms, ma'am.
Okay, there are 8 rooms only.
Ma'am, but the
That's okay. That's okay.
guidelines would be same, ma'am. 1, 2, 3 for IDI
Okay,
for
okay.
patients and same.
Okay,
I'm
okay.
opening the breakout rooms. I request everyone to kindly join.
Yes, please. You will see a prompt in your Zoom this thing, whether you when you have